Sometimes after a baby is diagnosed with HIE, families hear that the umbilical cord was compressed during labor. That word can sound simple, but it can actually be a sign of some very serious issues. The umbilical cord is the baby's lifeline. It's carrying oxygen from the placenta to the baby. And when that cord can get squeezed, even for a short amount of time, the baby's oxygen supply, it can drop. And if this happens repeatedly or for too long without being fixed, it can lead to a brain injury like HIE or hypoxic ischemic encephalopathy. It's important to know that some cord compression is going to happen in many labors. It's not unusual to see a few brief squeezes on the monitor. The danger comes when the cord stays compressed for too long or the baby's heart rate begins to show signs that the oxygen supply was not being recovered during the contractions. And this is when the risk for a brain injury grows. Doctors and nurses use electronic fetal monitoring to watch the baby's heart rate during labor. One common sign of cord compression can be something called a variable deceleration. And that means that the baby's heart rate is suddenly dips, often out of sync with the contractions. And then it goes back up. And if those dips, they become deep and they last too long or happen again and again without improvement, the doctors and nurses, they have to act fast. There are several ways to try to relieve cord compression. You can change the mother's position to take pressure off the cord. They may give oxygen. They may start to use IV fluids to try to improve blood flow. Sometimes they can reduce medications like Pitocin, which can make the contractions too strong or too frequent. In certain cases, doctors may perform an amnio infusion, which means that they're adding fluid to the uterus to cushion the cord. If none of these steps are working and the baby's heart rate doesn't stabilize, then an emergency delivery or an emergency C-section may be the only way to go to help the baby out. If cord compression goes on for too long without being relieved, the baby's brain can start to suffer from a lack of oxygen and blood flow, and that's what causes hypoxic ischemic encephalopathy or HIE. The brain cells can get damaged in a way that can lead to lasting challenges, and for some babies, they may go on to suffer cerebral palsy. Hearing this after your baby's birth can be terrifying. It can raise questions: could more have been done to protect your child? Knowing how cord compression works, how it shows up on the monitor, and the steps that can be taken can help you understand your baby's story better. Again, I'm Marcus Boston. If you have any other questions about your baby's HIE brain injury at birth or subsequent CP diagnosis from a medical legal standpoint, don't hesitate to reach out and contact me. You can find out more information about me and my profile. If you're watching this video on certain apps, you can send me a DM and we can chat a little bit about your baby story, or you can just wait and watch the picture that follows the end of this video. All right, that's going to be it for this morning's quick educational video. Have a great day, everybody.